A.LePage. I'm performing my head-to-toe assessment for Maryville University Health Assessment. This is my patient, Teresa. She has emptied her bladder, we've obtained her height, weight, vital signs, and she's performed a visual acuity by the Snellen chart. So we will first start by inspecting her scalp and her face. We'll check for any skin lesions, discoloration, make sure everything's symmetrical. I will palpate her head, look for any lesions again, feel the texture of her hair, check for any spots that there's missing hair. I will touch her facial bones. Okay, I'm not feeling anything abnormal. I'll have you open your mouth and close it, feeling for the temporal mandibular joint, no popping. Touch your sinuses, your maxillary, and your frontal. Just feel for any pressure. And everything looks symmetrical. So we'll move on to your eyes. We're going to look at the appendix, make sure there's no swelling. Okay, we'll look at your sclera, make sure it's white, no redness, and then look at the conjunctiva, no redness, no swelling, no drainage, it's not pale, it's just nice and pink. Just look there, both sides. Okay, and then we will do a cover-uncover test, and we'll just have you cover that eye. Perfect. And let me know whenever you see my fingers coming in. See them. Okay, I'm going to cover the other eye. See them. Very good. All right. And I'll have you look straight ahead. We'll check for your pupillary response. Okay, and then we look for consensual response. Looking straight ahead. Very good. We'll do the other eye. And then we'll check for another pupillary response. Very good. Now we'll move to the cardinal field of gaze. So I'll have you just follow this light. We're going to go up. Very good. Good. That's great. And no pain. We were watching for eye movement, making sure there was no jumping, no cross-eye, nothing like that. Very good. I'll have you open your mouth and say, Very good. And I'm looking at the uvula, I'm looking at the tonsils, the soft, hard palate, looking at her teeth, making sure there's no missing teeth, no cavities in those teeth. Have you stick your tongue out, all right, looking at the tongue, make sure it's not dry, not cracked, looking underneath the tongue, side to side, looking for any oral cancers. Very good. Lips are nice and symmetrical, no skin lesions. I'll have you puff out your cheeks. Good. Can you stick your tongue out? Good. Can you smile? Clench down your teeth. Good. Can you raise your eyebrows? Okay. What about shrug your shoulders? Very good. Okay. And then we'll look up in your nose. We'll inspect it, make sure it's symmetrical. No midline, make sure it's midline, no deviations. Look actually into our nose, make sure it's not boggy, congested. That looks good. Okay. So then we'll move to your ears. We'll just inspect each ear. Okay, very good. That looks good. We will do a light touch. I'll just have you close your eyes and tell me when you feel this. Good. 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 Okay. Very good. Okay. And then I'll feel your ears, feel for any nodulars, any discoloration, any skin lesions, feeling the pinna. And I'll look inside your ears. Okay, so we'll move on to the hearing exam. The first one I'll do is the Weber exam. So I'll put this on top of your head. Just let me know and make sure that you hear it in both ears.
I hear it in both ears.
Okay, the next one is the rhyme test. And this just measures and compares the air conduction versus bone conduction. Put down your mask really well. Let me know when it's gone. Okay.
And it's gone.
We'll try this side.
Gone.
Very good. Okay, so that consists of your ear. Okay. So now we will look at your neck. We're going to make sure that your trachea is midline, no deviations. I will go back and palpate her thyroid. Okay. So just up there. Can you swallow? Good. Good. so I will listen to your carotid arteries, both sides. Sounds good. No thrills, no roots. Very good. Okay. And so I will also look at your thyroid. I look at that and didn't feel anything abnormal. We'll go to lymph nodes. We'll do the preauricular, postauricular, occipital, the tonsillar, submental, submandibular, superficial cervical chain, the posterior cervical chain, the deep cervical, the supraclavicular, the infraclavicular. Have you raise your arms out, and this is the axillary, and I would say infraclavicular axillary. Okay. And those all feel normal, no swelling. They're able to move, they're mobile, so very good. All right, and so we'll move on to her lungs. So we're going to watch for the raise and fall of her chest, make sure that there's no labor to her breathing, and it looks normal. Start by light palpation, so we'll just feel here, each area, laterally, and then underneath. And I'll do anterior first, and then we'll move to posterior. And so we'll just do a percussion through here, just feeling for any dullness or any dullness or any hyper resonance. So you're good. All right. So then I'll take a listen. Okay. So deep breath in and out. Good. All right. Checking for normal breath sounds, make sure that there's no diminished, wheezing, bronchi, anything like that. Okay, so I will, perfect, thank you. All right, so I'm just going to have you say, I'm going to check for firmitus, tactile firmitus, and so I'll just have you say 99,
99, 99, 99, 99, 99.
Good job. All right, very good. So then we'll also do the light palpation again. All right, very good. And I don't feel any abnormalities. And we'll do a percussion. Not feeling any abnormalities there. And so we'll also do a diaphragmatic excursion. So I'm going to start here and palpitate down until I feel any changes. So right here. And we'll start by going up. Alright, so we're 3 to 5 centimeters. So I'll just have you take a deep breath in. Very good. Yes, perfect. And I'm just going to listen, auscultate to you at this time. So deep breath in and out. Deep breath in and out. Good. Deep breath in and out. Good. Deep breath in and out. Deep breath in and out. Deep breath in and out. Very good. Go ahead and turn it around. And I wanted to make sure I had you shrug your shoulders earlier. And I also wanted to check for jugular vein distension, which I did not see at that time either. So very good. So then we'll move on to the heart. So first I'm just going to palpate and feel her heart. We'll feel it here in the apical down here. Very good. And so we'll listen to the aortic region, for the S1, S2 sound. And then we'll move to the pulmonic. Okay, very good. Herbs, point. Tricuspid. And then the mitral. And I didn't hear any thrills or worries, so very good. Okay. So we also want to, I'm going to want to auscultate your aortic, your renal, your iliac, and femoral pulses. So what I'll have you do is lay down. Okay. I'll come around to the other side. Okay. So I'm just going to listen to your aortic with the belt. Okay, so then we'll go to the renal. both sides. Your iliac. And the femoral. Very good. I'm going to move on to the stomach, and so I will first auscultate your abdominal right lower quadrant. Your vowel sounds. And then we'll move to the palpate. I'm feeling for the liver borders, and then I'll feel for the spleen borders. So I'm just going to palpate first. Light. So then I'm going through this. I'm just going to press there. No changes there. So you take a deep breath. Not able to fill those borders. Do the same on this side. Take a deep breath. Very good. Okay. And so now I'll do a light palpitation. Any pain. I'm going to feel for each kidney. Now we'll do a deep. Very good. Now to set up. Feel any abnormalities, no lumps, no tenderness. Okay. So if you want to feel the pulses, each extremity. Good. This is the brachial. And we'll check for your reflex here. Actually, you know, we'll just go ahead and check your body strength. Push up. Okay, now push down. Off to the side. Push down. Or sorry, up. And push down. Good job. Alright, very good. Alright, and then we'll check your wrist. That's your wrist. Good pulses here, no thrills, heaves. We'll go ahead and check the reflexes and knees. Good. Alright, so then we'll move down to your knees. Actually, as we're looking at your arms, we want to make sure there's they're pink to warm, capillary reflex is good. We just want to make sure that there's no unusual hair distribution. We'll look on both sides for that. Those both look great. So moving down to her knees, we'll look at we'll feel the posterior popliteal pulse on both sides. Check reflexes. Good. Alright, and then we'll come down to the pedal pulse, posterior tibula, and both of those are strong and great. You're going to look at her feet, make sure there's no swelling, check her toes, everything looks great. And then we'll also check her reflexes in the Achilles tendon. Okay, so here. Alright, very good. Alright, so we will have you now stand up, and we're going to check her cervical and spinal, make sure that everything is in line. So I'll just have you bend forward to reach your toes, and very good. Everything seems to be in line, so that looks good. Very good. I'll just go ahead and have a seat. And so that concludes our assessment. So thank you very much.